I'm Goldspink, registered osteopath and senior lecturer. I've been practicing 25 years and lecturing 24. I lecture in London, Vienna and Munich. Hoping to put on a postgraduate course at the Vienna School of Osteopathy at the end of February. And so we'll be looking at common shoulder problems and how other regions are related in biomechanical terms and so forth. What you learn from this course will be, first and foremost, I'll deliver you some lecture material which is very latest understanding in the last few years of certain shoulder problems. For example, frozen shoulder seems to be on the rise, a lot more cases, and how this starts as an inflammatory phase. And if caught early, you can hopefully stave off it going on to the later stages. And then I'll show you some examination approaches, very simple and concise and reproducible. Over the years, I've worked with orthopedics, shoulder specialists, physios and osteopaths who specialize in the shoulder, and really taking those examination techniques that are reliable. Then in terms of treatment, I've developed a treatment to the shoulder, in particular the glenohumeral joint, which is a decompression approach to the joint capsule and surrounding structure. And this approach is very precise and very focal, but based on the delegates who've done the course in the past I've delivered in London, Vienna, they say while it's very focused, it's very gentle. And I was sort of developed this approach when I was working in multidisciplinary medical teams in my first 10 years of practicing in professional sport and various specialist musculoskeletal units. One was almost required to get quick results, but without adverse treatment reactions, particularly in professional sport. And then I'll show you treatment approaches that bring in other regions, really important regions, cervico-thoracic, upper rib cage and down into the elbow complex. And then we'll talk about a little bit of rehab, very simple rehab based on some latest understanding from various physios who specialize in the shoulders rehabilitation. And this rehab approach I've been showing to my patients for the last few years, and they say it's probably the most effective because it's very simple and it's very reproducible. So yeah, probably the most important thing delegates respond back to me is that they enjoy the course, it's fun, but they learn an awful lot, and they learn stuff that they can take into the practice straight away, which is really important. And yeah, I hope to see you at the end of February at the Vienna School of Osteopathy. But in the meantime, have a lovely Christmas and a Happy New Year.